Hello everyone, this is Dr. Sam, and today we will learn about renal abscess on ultrasound. A renal abscess can occur secondary to acute pyelonephritis. Kidney stones, diabetes mellitus, and urinary tract obstruction are risk factors. We will compare the renal abscess ultrasound appearances with normal kidney appearances for a better understanding. On the left is a normal right kidney in the longitudinal view. The normal kidney has a hypoechoic outer cortex, an even more hypoechoic inner medulla, and hyperechoic renal sinus. This is the normal appearance of the kidney. On the right, there is a well-defined hypoechoic collection in the upper pole of the right kidney. This is a renal abscess. The kidney has a heterogeneous and hyperechoic appearance due to pyelonephritis. Many abscesses can show internal echoes, which may give them a heterogeneous appearance. One main feature that differentiates an abscess from other lesions, such as tumors, is that it will not have internal vascularity on Doppler. No Doppler signals will be found in the abscess. An abscess in early stage may appear more solid and hypoechoic, mimicking a tumor. This abscess is present in the lower pole of the left kidney. Over time, a mature abscess becomes anechoic with cystic areas and echogenic internal debris or internal septations. You will find black anechoic regions in the abscess with internal debris. The debris can be present in the early stage as well. It is the echogenicity that can change over time. Here is a case of a renal abscess in the upper pole of the left kidney. A renal cyst is also present. This abscess is in its early stage. It has a hypoechoic echogenicity with echogenic internal debris. This image shows a well-defined lesion with anechoic areas and echogenic internal debris. No internal vascularity was noted on color Doppler. The abscess does not show internal vascularity on color Doppler, but it will show strong peripheral vascularity. This feature can distinguish a renal abscess from tumors, although further evaluation with a CT scan may be needed. Also, the imaging features are correlated with the patient's history and clinical presentation. In the most common scenario, a renal abscess develops as a complication of acute pyelonephritis. Typically, the patient has a recent or partially treated urinary tract infection and continues to have a persistent fever lasting more than 4 to 5 days, despite appropriate antibiotic therapy. This lack of clinical improvement should raise concern for abscess formation. Many of these patients have underlying risk factors, most commonly diabetes mellitus, which impairs immune response and promotes infection. Urinary obstruction, such as from a kidney stone or ureteric stricture, is another important contributor because it prevents adequate drainage and allows bacteria to proliferate. A history of recurrent urinary tract infections further increases the risk, as repeated infections can predispose the kidney to localized suppurative complications like a renal abscess. Laboratory findings typically reflect an ongoing bacterial infection. Most patients demonstrate leukocytosis, meaning an elevated white blood cell count, along with increased inflammatory markers such as CRP and ESR. A urine culture is often positive, especially in cases arising from ascending urinary tract infections, with E. coli being the most common organism. Blood cultures may also be positive, particularly in more severe or hematogenous cases. Despite the infection, serum creatinine is usually normal unless the patient develops severe infection, sepsis, obstruction, or associated acute kidney injury. Thank you so much for watching. Stay tuned for more imaging videos.